Welcome everyone to the Home Health Diagnostic and Monitoring Finalist Spotlight session. This is the 7th annual Digital Health Awards. I'm thrilled to be joined by Mark Goldstein, our executive producer, CEO, Great Gums, and partner at Builders VC, as well as Stephen Collins, CEO at Matter. Today, you'll hear directly from the standout finalist in this important category, companies shaping the future of healthcare across the globe. I'm Bethany Boschert, show director of the Digital Health Awards, and I'm excited to welcome you. This is my 4th year with the Digital Health Hub, and it's been amazing to watch how quickly the digital health space continues to evolve, especially in areas like this one. At the Digital Health Hub, we're here to celebrate the innovators shaping the future of healthcare. And thank you for joining us. Let me give a quick moment to introduce the Digital Health Hub Foundation. It's a 501c3 nonprofit behind today's session and the annual Digital Health Awards. We were founded in 2017 at UCSF with a mission to help the world's best digital health startups grow, scale, and succeed, ultimately improving care delivery, access, and outcomes for all. Throughout the year, we run educational programming, network events, and thought leadership series, all leading up to the biggest moment, the Digital Health Awards at Health in Las Vegas. We celebrate the companies truly transforming healthcare. We're proud to shine a light on this ecosystem and grateful to all of you for being part of it. Congratulations to our 2025 finalists. Your innovation, passion, and impact are helping shape the future of digital health. We're proud to recognize your work on this global stage. I want to hand it over to Jason, who is head of insights at CB Insights. Jason?
Hey, you doing, everyone? I'm Jason. I'm head of insights at CB Insights. We're a predictive intelligence on private markets and private companies provider. We're excited to partner with the Digital Health Hub folk and the Health Conference, which we will see you all at in less than 2 weeks. 2 weeks.
Mhm.
Um, to provide the context, intelligence, data on all of the companies innovating across the digital health ecosystem. Uh, for anyone who has any questions, happy to help you guys prep for, interact with during, and then follow up after the event, where our intelligence will be sort of at the center of the stage, including launching our own digital health 50 list and then putting our app and our intelligence at the center of the event. With that little bit of the intelligence to tee us up today on the home health and remote patient monitoring market. Unlike every, or not every other, but most of the other digital health hub categories where I have to make a big disclaimer that we've seen, you know, 2021 had a big influx of capital into the space, and we haven't seen that quite rebound yet. Home health in RPM is quite a different story, right? We're seeing already this year in 2025 record funding to the space, um, which sort of gets to the scale of the problem, right? Where there's a market that's expected to more than double by 2030. And we're seeing, as I mentioned, that funding recovery from the trough in 2023. Some of the hottest markets that we're seeing is the digital biomarker monitoring, right? That starts to blend a lot of the wearable tech, a lot of the now increasingly non-invasive tech around biomarker monitoring, and the increase in accessibility to all of that. We're seeing an increase in hospital at home platforms, a lot of sort of maternal care and fetal health in the pregnancy markets, and then increasing at home ECG monitoring that sort of ties back into some of the biomarker or has a nice Venn diagram overlap with both the hospital at home and the digital biomarker monitoring markets. Unsurprisingly, I'm going to go like this. I'm going to say AI, and we're all going to nod along with the fact that AI is reinventing a lot of these markets across everything in digital health. In the home health and remote patient monitoring markets, we're seeing that a lot of the use cases are around predictive analytics, early intervention, continuous monitoring, and then personalization, which I forgot to add onto this slide. And then we're seeing, an increasing number of primary use cases for chronic disease management and then sort of care across the life cycle of a patient. And then when we start to look at the emerging market signals, we see a lot, of it, a continued shift towards preventative monitoring and preventative care, which I think is something that we're seeing broadly across the digital health space. And we're seeing now that there's a lot of tailwind as more Medicaid programs are now covering RPM services, right? Really, again, signaling that this is a space seeing a ton of interest and one of the early, maybe not early, one of the best applications for continuous monitoring and continuous care. Right, there are some signals that we're seeing that are sort of getting, providing a little bit of a headwind. But all that said, massive tailwinds in the space and a ton of running room for all of the great companies that will present today to run into. And with that, pass it back to Bethany.
Yeah, thanks, Jason. All right, I'm going to introduce Stephen Collins, CEO of Matter. He's going to tell you a little bit about himself and then kick it over to Mark. But I'm super excited to hear from all of these companies. So, Stephen?
Well, thanks. I run Matter, a healthcare technology incubator and innovation hub. We're based in Chicago, but we work with startups all over the world. We've supported 1,000 companies now that have raised $5 billion to fuel their growth over the last 10 years. We also work very closely with large health systems and life sciences companies and payers to help them innovate more effectively, and have spent a lot of time in this particular space where the opportunities to collect data in different ways and different methodologies and for different purposes and analyze it and then deliver insights. We see growing potential, both near term but also truly transformational in the coming years to really transform healthcare. So really excited to be a part of this and get to talk to each of these companies. And I'll turn it over to Mark.
Great. Thank you, Stephen. Okay, Bethany, tell me, flip me on and I'm ready to go. So I'm Mark Goldstein, and I am the one of the executive producers at for the show that's coming up in 2 weeks. And I'm super excited about this category. Well, first of all, this category is if you look at the best in class companies, a number of the companies have been around for years, and they're really, really starting to scale right now. And it's exciting. We've seen these companies as finalists in past years. I know we're going to get some great winners this year. I'm not going to sit between you and the companies, but one thing that I can say is this is the core of it all. This is the stuff that's fine. Without these companies doing what they do, digital health can't happen, because it was the whole idea was bridging from the hospital to the home, and you can't do it without you guys. And really, with that, I'm excited on behalf of the foundation. Really, I know we have Stephen here moderating. I have a really easy role because Stephen is really good at this stuff. And the next 40 minutes are really all you. So with that, I'm going to hand it back to Stephen.
All right, well, thanks, Mark. So we've got 40 minutes and a bunch of companies. And so the idea is not to dig deep into each of the companies, but would love to kick it off, and I'll sort of go down the list, but hear from everybody as to what's the big idea that you're pursuing. Why is this category yours to uniquely win? And would love in your answer, because one of the biggest challenges in healthcare generally, but certainly in this space that we've seen, is that there is the possibility to create solutions that improve diagnostics and care, and that is almost a completely different question from the one about creating a business model that can actually be viable. So touching on both of those, which are going to be necessary for success. And so we can just go on down the line, starting with James from Telehealth Care Solutions.
Yeah, great. I mean, it was a great introduction. I'm James Cerruti. I'm a cardiologist and CEO of VP Exam from Telehealth Care Solutions. Really excited to be invited as a finalist. We've participated with the Digital Health Hub in the past. We've always appreciated their support. It's a great institution. So VP Exam, I think, is unique compared to our competitors. We transform health diagnostics from passive monitoring into clinically actionable intelligence. And we really focus around using augmented reality to guide the users through doing a physical exam. Because one of the biggest problems I've had as a physician, and a lot of my colleagues, is we need the complex data to make decisions. We can't just have a single data point. So our augmented reality will gather a variety of data like volume status, like jugular venous distension, lower extremity edema. And we split professional diagnostic equipment like stethoscopes with ECG from different partners. We can do a full auscultation of the heart and lungs and tell if people are in pulmonary edema. We can also use EKGs on the stethoscope or wearables and transmit that data as well. And that's why, we tap into Apple Health, Google Fit, and our AI and our algorithms can help identify abnormalities and vitals sooner, and then we do these physical exams sooner and get these kind of patients back on track. It's especially helpful for heart failure patients, but really cardiac, pulmonary, really sick patients where just RPM alerts by themselves aren't going to be enough, and you still want to manage them more aggressively. So we're proud of our clinical data. We've had over 35% reduction in hospital readmissions, over 56% reduction in 30-day mortality when you look at the relative risk. And our return on investment for our healthcare providers and hospitals has been about 3 to 5 times. So, VP Exam turns home diagnostics into a clinical asset class, and we're not just a monitoring expense. So that's our little pitch.
We'll do Starling Medical next.
Awesome. Thank you very much. Really happy to be here. My name is Dr. Drew Hendricks. I'm an emergency resident physician here in the Bay Area. I'm with Starling Medical, one of the co-founders, and we've created Urindex, which is a toilet indwelling device and associated platform that utilizes advanced spectroscopy to provide a detailed fingerprint of urine samples. It essentially scans your urine for analytes and other characteristics such as turbidity, which are relevant to certain chronic health conditions. Now, the device has been designed to seamlessly integrate into anyone's bathroom routine in order to easily collect data, and it makes a virtual care team accessible in order to engage with the patient and the provider in preventative health pathways in order to reduce the risk and burden of a lot of these chronic conditions. Our goal is pretty simple. It's to keep people out of the emergency department, out of the hospital for preventable health conditions. We serve a very large population that is desperate for a solution right now. And, we've created something that can really help people. We have a great team behind it.
All right. Thanks, Drew. How about Cairns Health? Andrew.
Hi, thank you for having me. My name is Andrew Ritter. I'm the CEO of Cairns Health, and we're really excited to be here because we have a great technology that's trying to help really simplify care. Care is so complicated and complex, especially for our seniors and polychronic patients. And engaging them at home is even more challenging. And so what we've developed is a digital care companion. It's a conversational AI that can have conversations with our polychronic patients and our seniors to help them engage them and help them through their care plans. We then connect them with their care teams, and we're really helping support providers be connected to their patients at home. And in this process, in this context, we're using intelligent sensing radar to monitor the context of the room and of the patients. We can do physiological parameters, we can do activity, mobility, but also behavioral environmental, because we can have conversations with the user. All of this passive data is then utilized and compartmentalized and then utilized through our voice to be able to communicate with the user and have full-on conversations with them. And so we're making complex care simple. We're using voice to communicate with users and empowering patients to be communicating their care to their providers and allowing providers a lower risk model to be able to engage their patients at home and really helping scale home care with patients. And we're currently in a multitude of senior care facilities and communities around the country, focusing on assisted living and independent living initially, but also going to expand to home care as well.
That's great. I'm resisting asking follow-up questions just so we can get through all the companies, but have so many. But all right, Maya MD, we have Amit.
Yeah, thank you very much. So Amit Kapoor, nephrologist by training, CEO of Maya MD, and the way we view our platform is really an end-to-end care solution for high-risk patients. So these are either patients with advanced kidney disease, advanced heart disease, et cetera, and really multifaceted. So we have remote monitoring, principal care management, and sort of preventing disease progression. We also have an application, and through the application, all the clinical information is stored for the patient. We have a conversational agent as well when the patient's at home. Again, symptom tracking, conversing with the patient, making sure they're compliant with their medications. It stores the information, it communicates with the patient and the provider as well. And also we have a search tool, so akin to sort of open evidence AI, proprietary, which allows patients to search information that's relative to their disease state. But added to that, and what I'm really proud of, is what we call Maya Red, which is our re-engineered discharge platform, which is an agent that will talk to the patient either at the day of discharge or immediately when they go home. And it's a 30 to 45-minute interaction with the patient, addressing the needs of the patient, why they were hospitalized, the reason for hospitalizations, medication review, lab review, follow-up appointment, and interacts with the patient, understands what the gaps are in care, follows up with the patient, and communicates that information to the provider. We've been in 60 randomized trials, 16,000 patients. We've shown a 30% reduction in 30-day readmits. From a patient satisfaction standpoint, 40% improvement from historical baseline in terms of patient satisfaction post-discharge, and a 25% increase in medication adherence through our platform. So thank you very much.
Thanks so much. All right, next up is Ashish from Dina.
Thanks for having me. I'm Ashish. I'm the CEO and co-founder of Dina. Dina is on a mission to improve access, reliability, and transparency to in-home services. I'm preaching to the choir here when I say that care is really going to be delivered in three ways moving forward. It's going to be in high-quality facilities. It's going to be accessed virtually, but it's also being brought to you. In fact, hundreds of millions of in-home visits take place on an annual basis here in the U.S. Much of those visits are able to collect some incredible insights and data based on the boots on the ground in the home, whether they're insights around someone's need as it relates to nutrition, to ambulation, to home modifications. There are many different factors that can really improve longevity and independence. Unfortunately, today, that data really doesn't go anywhere if it's captured, if at all. And so what Dina is really doing is improving access to these services, everything from traditional home health services all the way through to new emerging interventions like home modification services. When we get engaged in market, we're typically working with a government-sponsored program like Medicare Advantage or Managed Medicaid, and increasingly PACE programs, which is a really fantastic program. We're typically taking something that, unfortunately, from a care logistics perspective, may take days or weeks to arrange in terms of in-home services, and we're dropping it to 10 minutes or less on our network and on our platform. The solution is really sort of broken into two components. It's a digital network management solution that is really aggregating all of the in-home capacity in the community and creating an easy button that allows care coordinators to navigate to those actual individuals. That's sort of part one. The second part is the diagnostic part, harvesting data, sometimes structured like OASIS assessments from home health agencies or MDS for home care data from Medicaid certified personal care agencies. But oftentimes there's unstructured visit notes that are captured by non-medical home care workers. All of that is fantastic, untapped data. And we're on a mission to really improve that access, but really create transparency. And, you know, what we've seen are some really remarkable results. We started out years ago in the small market in just outside of Philadelphia. We're now scaling in 10 plus US states with quite a bit of access. So we're just getting started. There's some really remarkable companies and innovations on this call alone, but in the industry. Love the work that's being done from an RPM and diagnostic perspective. But I think as equally important is pairing that with the human in the loop in the home. And that's really what Dina is orchestrating. Really appreciate the opportunity to be here, and thank you all.
Thanks so much. All right, let's hear from Houston Bionics.
Hello, everyone. This is Yogi Sisman. I'm the co-founder and chief business officer of Houston Bionics. at Houston Bionics, we've developed a therapy/monitoring platform that transitions any kind of home into a rehab environment for stroke survivors. The platform has two components, the software and the hardware. And the software enables kind of the ecosystem that brings providers, meaning the doctors and the therapists, to monitor what their patients are doing upon discharge, and also gamifies the entire journey while the stroke survivors are doing the therapy, they're actually playing games and keep them consistent. And the hardware component, the hardware platform, provides the correct movements, prevents the compensation, and in order to visualize what's happening for stroke survivors is imagine for your upper extremity, for your arm, you want to make a move on your wrist, but before you make the move, you're letting a 300-pound person to sit on your wrist, and then you're trying to make the move. What happens is the patients start compensating with the other side of their body that is not impacted, and thus kind of prevent the outcome, the desired outcome, because you're not focusing on that particular joint. So the platform from a 10,000 feet approach provides the necessary amount of therapy in a high intensity and high repetition manner to the patients, while enabling providers, including therapists and the doctors and the caregivers, to monitor what their patients are doing in a home environment. And this is the first time they're having this capability. Prior to ExoRehab, prior to Houston Bionics, once a patient is discharged into home, they're discharging their patients into a big unknown. Now they can actually physically track what the patients are doing and if the patients are doing the right amount of therapy. We have run the controlled clinical study and compared the ExoRehab with the in-clinic sessions with an actual therapist, and we have generated 3 times higher patient improvements as the device isolates the movement and provides 4 times or 5 times more repetition in a given period of time. So that's 3 times faster recovery with ExoRehab. Our device recently got reimbursed by Medicare, and now we are seeing adoption in the commercial payers as well. Our business model is not to go physician office to physician office, but to engage with the health systems in a more care continuum manner. We are starting our engagement with one of the top 3 health systems in the States that is focusing on specifically stroke rehab, and we'll be embedding our platform as the post-discharge care, as part of the post-discharge care continuum. We're quite looking forward to what's ahead of us and quite excited to be here. And congratulations to all the finalists. And thank you to the team.
Thank you. So interesting. Let's turn it to Beth from Sonar MD.
Thank you. So Stephen heard the original pitch, I believe, from our physician founder. And we were founded, I think, on 2 basic premises. So one is chronic GI patients tend to normalize their symptoms. So as a result, have a really hard time raising their hand, calling their doctor and saying, I need care now. So that was one recognition that he had. The other recognition, which is clinically validated, is that if you keep closer tabs on patients that have chronic inflammation, you can change the course of the disease by keeping it at bay. So it's really those 2 pieces that founded the company. We manage deterioration between visits. We prevent unnecessary utilization. Inflammatory bowel disease represents 50% of the variable cost of chronic GI conditions. So we are focused specifically on that disease, but recognize that the GI space itself is huge. It's about $100 billion, and it's really untouched by any value-based innovation. We have shown over the past 5 years that we can reduce total cost of care by up to 15%. And we have some incredible numbers around the amount of inpatient stays that we've been able to decline, in particular for those patients that stay in the program longer. Armed with all of this data, we have a pretty good go-to-market. And I love the second part of your question, Stephen, because I think it's really important. None of us that all have fantastic technologies can do the work without a partnership with somebody that cares about the total cost of care. And so we have partnered in value-based arrangements with payers. We are with 4 payers right now, and we're scaling nationally. We also, everything we do in partnership with the GI physicians. So the GI space right now, there's a pretty big shortage of GI physicians. So anything that we can do to surface the right patients at the right time is actually ensuring that that scarce resource is receiving the care, is seeing the patients that they should be seeing, and that the patients that are being monitored at home have the resources they need to self-monitor themselves. So we're excited about where we're at. I agree. I've met several of you, and you're all doing great things. Thanks.
Great. Steve, is that the group? Is that the Rising Star group?
One more, Radio Life.
Hi, everyone. My name is Sergio, and I'm the founder and CEO of Radio Life. And at Radio Life, we're reimagining diagnostics from the ground up. We've developed CubeScan. And as you can see, it's a portable device that uses radio frequency signals and AI, no reagents, to detect pathogens and biomarkers in just seconds. Instead of sending samples to a lab and waiting days, CubeScan reads the sample's radio frequency signature right on the spot. It's fast, portable, and designed for real-world use, from clinics to homes to the field. We're still pre-market, but our early studies and collaborations with Maine Health, Nordex, and the Institute for Experiential AI have already shown how powerful this technology can be. Long story short, Radio Life isn't just advancing diagnostics, we are redefining what diagnostics can be: sustainable, accessible, and instant. Our mission is simple: to make lab-level testing as easy and universal as checking your temperature.
Nice. That is Sergio. Sorry, I can't believe I forgot, didn't hear you talk. Look, before I hand this over to Stephen, Stephen's going to lead off with a few additional questions. These are for the Rising Stars. We're going to get to best of class later. The real things that I want you to think about when answering Stephen's questions is, why should you win? Why are you great? But why are you solving a big problem? Because obviously all you companies are amazing. So it's like really focus on those 3 things with Steve's questions. Stephen, run with it.
Perfect. All right. Well, I'll just run back down the line again. With that context in mind, what is the biggest barrier that you've had to adoption and scale? And along the lines of what Mark was saying, the future state where your company is fully deployed and is out there everywhere, how has healthcare been transformed?
And in 20 seconds or less for each of you.
Seconds or less, starting with
Oh, no, I'm
telehealth
just looking at the time. So that's all.
solution. Yeah.
All right, I'm going to keep it brief. To get into hospital systems and have physicians engaged is a challenge, and you have to show really strong outcomes, which I think we've done, but then you also have to show that it's going to be an easy workflow and there's going to be a high return on investment to our leadership in the hospital system, or it won't be adopted. So that's where we had the biggest success, is using our prior successes with improving cardiac and post-op and heart failure management, and using that to get physicians excited and having them adopt this technology into their everyday practice for a lot of their sick patients, whether they're home, in the nursing home, or in home care. So we're building the infrastructure for value-based home care, and this is kind of clinical precision that can scale like software, but it's pulling in the physician to really immediately act upon this data, as opposed to having to hit the emergency button in some of the emergency room or the hospital. So kept it brief.
Thank you. Starling where's Drew? There's
right here. Yeah, thank you very much. So also, to keep it relatively brief, I would say almost every single industry moves faster than healthcare in terms of adopting new innovation and new technologies. There's lots of physicians on this call today, and I'm sure they could tell you that if anybody were to propose a solution that alters their already established care pathways, they would start to sweat. And one of the biggest barriers that we've found just in innovating in the healthcare space is that remote patient monitoring in particular is relatively new in urology. But this is something we've been able to overcome quite easily because the need we're going after is so universally understood by all the providers. It's just a manner of logistically integrating into what they already do in order to make their lives easier, not harder.
Right. Amit. No, Andrew from Cairns Health. And then Amit.
Thanks, Stephen. What really separates us is that we are a digital care companion. We're Alexa for healthcare, is what it is. Like, we're literally a device that sits in the home, and we're proactive because we understand the context of the room. We understand when the patient enters the room, leaves the room, gets up, wakes up, goes to sleep. And based on that, we're proactive in communicating, reminding them to take their medications, nudging them to do certain things, getting feedback from them. And so that's what makes us different. Everyone has a phone, everyone has a camera. This is context in a room driven by voice conversation that creates a companion relationship with the user as like literally a caregiver in the home, but digitally, enabling more scalable connection with patients at home for providers.
Great. Now Amit.
Thank you. So for us, I mean, the solution is simple: readmission rates. Population's getting older. On annual, 27 million patients, Medicare patients, are admitted yearly. Readmission rates 15 to 20%. For our high-risk patients, that's 20 to 30%. To date, there hasn't really been an effective solution. So with our platform, the ability to reduce readmit rates by 30% in a heart failure population where the annual cost is about 5 million for readmissions, 5 billion for readmissions, and kidney patients where the annual cost is about 2.5 billion for patients, our ability to impact that, and at the same time where patients are saying, hey, this is transformative to me, I've never had a solution like this. And from a nursing perspective, we're able to reduce about 20 minutes per discharge per patient from a nurse's schedule, from a nursing time. That's transformative for a nurse as well. And that's where we get the health system adoption. Our biggest pain point, obviously, is, as alluded to earlier, is how do we integrate into a hospital, into their EMRs. But through the traction we're making clinically, we're finding more sort of tailwinds on that end to get better traction and scale within hospitals.
It's great. I mean, that integration is always a nightmare. Dina, Ashish.
Thanks. Just to be really brief, 10,000 people are turning 65 years old every single day. Actually, the number is probably taken up towards 11 to 12,000. That's sort of our launch point as a business. An overwhelming majority of seniors require in-home care. Actually, I think 85% of the in-home visits are driven by seniors. I think the entire industry, if you've been around this problem, you've likely experienced a missed visit, a delayed visit, or no visit at all. We're talking about really complex people who have big problems when a caregiver doesn't show up when they need them to help with pain management, ambulation, support with medical equipment. Dina's the easy button that I think all of these innovations in the market are really going to need to pair with really smart diagnostic solutions and good virtual care and in-person care. The in-home community is a real extension of how care is delivered. We're a foundational platform for the industry. Some of the barriers that we have overcome, Stephen, just to come back to your original question there, is the business model. We are not charging in-home care providers to be a part of the network and our solution. Our customers, our paying customers, are government-sponsored programs and or payviders. They sponsor the deployment of the solution. They finance it. They ultimately reap the greatest benefit. But in order to solve the supply and demand problem, you need to draft in all of the in-home care providers, and that's what Dina is doing in a very scalable and efficient manner. Would love your vote. We think we're a really important part of the stack, but there's some really great companies here too. So thanks again.
Thanks. Houston Bionics.
So there are 7.2 million stroke survivors, with 800,000 stroke survivors are adding to the population every year. And once these people are discharged from hospitals, they're told that they need to do 5 to 6 times of therapy session each week for a long period of time. So key here, the barrier that we are overcoming as Houston Bionics is the independence. If you expect from someone to do something 5 to 6 times a week, you need to build a platform, deliver to it, and you need to make sure that the person can use it independently without requiring any supervision from a caregiver or a therapist. So this is what we built at X3FX and in Houston Bionics. And what this will evolve into the future is, as the platform collects real-world data, it will open the doors, first time ever, to real-world evidence studies in this field, while generating sufficient amount of data for clinical providers to manipulate and generate additional clinical findings based on the therapy progresses. So we bring the independence, the barrier that we are overcoming, and we are opening the door to additional studies to understand this stroke management in a more deeper way.
Thank you. All right, Beth, and then Sergio.
Sure. So an IBD patient represents about 1.5% of the population, 3% of the commercial spend. That's growing because IBD patients are generally managed with very high cost biologics. And the innovations over the past 3 years even just have really increased the price of those biologics, so that cost is rising for commercial payers. The good news about managing a patient like that is that 70% of their total cost of care can be attributed to their disease. So when you manage that patient, you are managing most of their spend. What our biggest barrier is to scaling is those payers being able to carve out that group, and we don't want to be a one-off for those payers. So I'm actually cheering very loudly for the adjudicators out there, the companies that are trying to make value-based care really easy to adjudicate, so that you can see where those costs are coming from, and you can keep people like us accountable to hitting specific outcomes and be able to attribute those outcomes exactly to us, because we want to show off. What we see coming is there are so many more ways that we can collect data and information than what we collect right now. So because we are attributed patients from the payer, we already get a ton of claims data. We're getting patient-reported outcomes data. We are now getting biometric data. We get admit, discharge, transfer data already. So together, that really helps us get more and more predictive. So my hope for some of these patients is that I don't have to bug them via text, that I already actually know where they're at in their care journey, and I can tell them what the next best opportunity is for them, whether that be diet, nutrition, sleep, or any of the other things that are being innovated out there. So thank you.
Thank you. All right, Sergio.
Yes, so the current state of diagnostic solutions is slow and expensive, with culture tests taking days to provide results. The gold standard PCR taking hours. They're super accurate, but they still need all those expensive reagents, and they need a full-on lab with highly trained people to run them. And our competitive advantage and why we believe we should win is because RadioLife's technology completely eliminates the need for reagents and can be applied to remote settings for a fraction of the cost of existing applications, with the potential to impact millions of lives and patients globally.
All right. Mark, should we flip to the...
Yeah, so that was, we're going to flip now to the best of class. It's going to go a lot more quickly because we only have 4 companies, 3 of which are here. Love all you rising stars to stay. You should see what the best of class companies have to say, because this is going to be you shortly. But wow, what a great group of companies. Stephen, bring on the best of class.
Yeah, I mean, so such an interesting group of companies. I love the diversity. I mean, it is like fitting in within this category of home health and diagnostic. There's just so many different ways to improve it. It's a very impressive set of technologies, set of companies, set of business models. So again, switching gears to the best in class, we've got 3 terrific companies, and would love to hear. We'll start, Sam, with you and Xander Cardian, and would love to hear how it is that that your solution is really changing the world in effect. What's unique about it, and why essentially why are you going to be the next biggest thing?
Certainly. Good to be here, and good to see a lot of familiar faces. We've been working on radar signal processing products for 13 years as a company, 8 years. We've been preaching about this for a long time. This is one of our products. The basics, heart rate, breathing, monitoring, sleep monitoring, non-compliant. But here's an update. So after 44,000 unique patients being monitored under our radar, we found that about 3 days before someone has a heart attack, we were sounding the alarm. UTI, about 5 to 7 days earlier. Even death, hospice application. In fact, we have monitored over 340 people who unfortunately passed away under our radar while they were in a sniff. And we saw more than 80% had our alarms going off about 5 to 7 days earlier. There are signs from our body that's so unique, never mind just BPM. We're talking about unique patterns to the heart moving, including heart harmonics, doubling of the left ventricle, for example, that's uniquely capable or detected using radar versus regular EKGs or even PPG sensors with wearables. So these unique information are predictors of a certain type of outcome. And it kind of, it really gives us, even me as a founder CEO, goosebumps because we didn't know this. These are all discoveries. And so we've been really focused on the validations, clinical validations. And this has been now giving us the ability to move not only across lots of facilities in the US, about 150 facilities. We're quite busy working with lots of RPM companies. It is reimbursed. We're moving into moving about 50,000 products by end of this year. Next year, about 500,000 units. We're super proud of that achievement, and also globally. What's the big problem that we're solving? We are enabling aging in place. That's the number one thing that's being a lot of interest for countries all over the world, not just USA. We've got 56 million seniors in the US. There's 211 million seniors in China and 36 million seniors in Japan. This is a global issue. And so we're so proud of actually being able to enable aging in place through this predictive AI-powered prediction of health deterioration. Yeah, so that's what we've been doing.
Well, thanks, Sam. Obviously, I've known you in the company for a long time, and I always thought one of the more interesting things is that it's ambient sensing and that you can pick up all of these all of these different things ambiently in sort of the least intrusive way possible. And so kudos to how far you've gotten and where the direction you're headed. Where is Drew? Drew Schiller from Validic.
Yeah, absolutely. Yeah. Thanks, everybody. Great to see you all. So Validic is the largest health IoT platform connecting hundreds of disparate connected health sources, everything in the home, blood pressure monitors, weight scales, glucose monitors, CGM, wearables, health apps in the phone, including, some of the devices represented here in this category. We connect all those devices into the EHR clinical workflow to enable better, more proactive care. And since launching to the market in 2013 and really helping create this category, we've seen personal connected health data shift from kind of a lifestyle curiosity to what is now a clinical necessity. And Validic doesn't focus on any one condition. We are instead a platform that supports dozens of different kinds of remote care programs across many combinations of consumer health devices and in-home health devices and data types. And so while the EHR focuses on in-hospital and in-clinic data and those workflows, what Validic really focuses on is outside the clinic and enabling and being an integrated partner with programs that span the entire patient life cycle, all the way from like high-risk conditions such as transitions of care programs, heart failure, chronic kidney disease, high-risk pregnancy, all the way through to preventative health programs such as weight management, healthy movement programs, diabetes, hypertension. And we're doing this at scale. We support the largest remote monitoring program in the country at a national IDN with over 500,000 patients having been enrolled by more than 7,500 clinicians. And this is in programs across acuity levels as well as multiple regions in the Epic clinical workflow. And really, Validic, the way to think about us is that we are a bet on the future of digital health. Like we're a bet that sensors will continue to improve, the way that we need to get these data and have them delivered, it becomes more important the more this data becomes clinically relevant. And this is what we've seen. And thanks to improved sensors and technologies, every single day, personal health data is more valuable to our health outcomes than it was yesterday. And our mission at Validic is to make personal health data actionable. And generative AI has actually really helped us further that mission in some exciting new ways. Notably, we launched a product this year called Validic Sparks that summarizes the data from all these disparate sources for clinicians in the EHR clinical workflow at the point of care, so that in seconds, the clinician can understand what's been going on for a patient, how well they're participating in the program, anything they need to pay attention to. And that way they can walk into a clinic visit understanding more about what they need to discuss with the patient and provide a better, more personalized care experience. And because of this, what we're seeing is that patients are receiving more tailored guidance. They feel a more personal connection with the healthcare provider, and that ultimately leads to a better care experience and improved health outcomes.
Well, thanks, Drew. I don't think we've met, but I've followed Validic, and I think it's just been interesting as you said that we've moved from this sort of early Fitbit, where everybody was poo-pooing the concept, and then it moved to a phase where doctors are like, I just don't want any of this because it's just too much noise. And I think what I've observed is that your company is helping translate all of that data into actionable information and in a really interesting way. So kudos to all the progress that you've made. And then last, Sadie, we haven't met, but I apologize. I have stepped on one of your scales literally every day for the last 15 years. I have a lot of weight data, but I never can remember if it's Withings or Wythings or how you pronounce it. But I do really appreciate your scale and look forward to hearing your thoughts.
Amazing. Love to see a long-time user. It is Withings, but you can say it however you want. We're a French company, so they pronounce a few things a little different. I'm Sadie Moore. I work with our B2B partners to create and optimize these really data-driven remote chronic condition management programs. And I love that you called it out. Like, Withings has been around for 15 plus years. We invented the first ever connected scale in 2009, the first ever connected blood pressure monitor in 2011. So we've really pioneered the idea of a connected device at home. We began in that consumer space, which is why a lot of you might have us in your bedroom or in your bathroom already. But we branched out to the B2B space with the idea that patients are consumers too. They also deserve to have a really nice looking, easy to use, engaging device. And care teams and clinicians want to make sure that they can trust that data. So it's that combination of a device that has a lot of retention. We see 90% retention after a year on our devices, but also the clinically validated backed data that we make super accessible and easy to them. They can pull it right into their EHR, right into their platform. We're not asking providers or care teams to go anywhere else rather than where they're comfortable, and they can really get that aggregate data. So we work with digital health programs, health systems, in the research space, in the pharma space, and this is in the US, but also worldwide. Currently, our devices are being used for over 11 chronic conditions to manage them. A lot of people know us for weight and body composition, which is so important among this GLP-1 era to make sure that we're tracking that lean mass and keeping patients healthy. But also hypertension, CHF, sleep apnea, we track in a really passive way right under their mattress. So our idea is to make this data easy to get and make it easy for clinicians and providers and care teams to access that data so that they can really personalize the care and the coaching that they're giving to that patient and to that patient's data. So we're continuing to come out with new devices. We're not just resting on, we made a smart scale 16 years ago. What we recently came out with is actually a blood pressure monitor where you can ask questions right on the screen of the device and patients can answer those. So totally customized to the program and to that specific patient. It could be, did you take your medication today, to check on adherence? It could be symptom reporting. It could be asking about the environment in which they took their reading, because that can really contribute to a high or a low reading. So once again, putting the power in the hands of the clinicians and in the hands of the care teams, but making it as easy as possible for patients to be able to get this information to their care teams so that when care teams and clinicians are interacting with patients, it's a really top of license interaction. You know, they're not just asking survey questions because that can already be done on the device. So the idea here is, you know, reducing clinician burnout, increasing engagement of patients, and really allowing providers and care teams to care for more patients overall. And so what we've done is we've really listened to the feedback of thousands of digital health programs, health systems, providers to see what are their bottlenecks, what are their pain points, and what can we build into a device to make their lives easier. One of the things that I'm most excited about is our risk scores that we're coming out with. So everyone knows how to step on a scale. So we're working on just being able to step on a scale and detect your risk of neuropathy, CHF, diabetes. And these are huge issues in today's society. Not everyone can go get a Pronovo scan or go to the doctor every week. So making care more accessible to people and really putting that preventative care first so that we can focus on well care instead of sick care.
This is great. Hey, so the one thing I want before Stephen asks the last quick question, we have one company that isn't here, which is Omron, and you probably all know of Omron. They basically make cuffs, and they're sort of ubiquitous cuff manufacturer. We have three. The companies you've heard here are wonderfully scaled. Validic, we've seen you grow from a rising star and watched you very closely, and it's amazing how you're doing all this integration. I guess look to Stephen, and there's just, if there was the one quick way you might answer the last question. Remember, the judges just need a reason to vote for you, a real fast reason. They're super busy. And so, you know, if you give them 15 seconds, and then we're almost ready to sign off, and wanted to thank everyone. Stephen, hand it off to you.
All right, Sam, 15 seconds. Why should the judges vote for you?
Sure. We're at the tip of the iceberg. Everything that I just mentioned before, all these discoveries, that's just the beginning for us. So we're very, very excited to change the standard of remote care, home care, and we think we're the right company that can open the new world for that.
All right, Drew.
Yeah, thanks. You know, Validic, again, I'll highlight, is really a bet on the future of digital health and the fact that, you know, the amazing work from Xander Cardian and Withings and Omron and all of the dozens of other companies that are continue to advance and get better sensors and better algorithms and better prediction out there, ultimately has to be easily accessible and accessible in the clinical workflow in the same way for clinicians every single time. And that's what really Validic enables at scale.
Sadie.
Yeah, I'll harp on it again. We invented the connected health space. We have come out with devices that make patients' life easier, that clinicians can trust. And then we're still continuing to innovate and come out with these new scores that are really unheard of to be able to make patients' lives easier and really focus on preventative health and medicine for everybody, not just for those who can afford it.
All right, that's a great set of rising stars. It's a great set of best-in-class companies. I'm looking forward to seeing all of you in a couple of weeks, and I'll pass it back to Bethany to wrap things up.
Yeah, thank you. Thank you, everybody. All right, make sure you mark your calendars for Monday, October 20th, where we crown our winners live across 4 stages at Health in Las Vegas. This grand finale schedule is on our website under the 2025 drop-down. There's an add to calendar for each stage, so it's supposed to make it really easy for you. And don't forget to join us afterwards at Chica and the Venetian from 6 to 9 p.m. where we toast the winners and celebrate the entire digital health community. DJ Klasko is supposed to be spinning Taylor Swift songs. That's what I heard from the last few calls he was on. So thank you, everybody, and congrats. You did great. Have a great day.
All right, we'll see you in Vegas.
Yeah, we will.
Thank you.
All right.
Bye, everybody.